As mentioned, we will be providing you with updates on several board initiatives that you as payers should be aware of. We recognize there's been a lot of activity and communications from the board on various initiatives over the past several months, so we wanted to bring it all together for you and give you an opportunity to ask questions. In today's session, we'll be covering several recent updates from the board, including, hot off the press, the first phase of our new business information system, OnBoard limited release. Updates on the New York Workers' Compensation Drug Formulary and the board's medical treatment guidelines, or MTGs. We'll cover the latest on the New York State Workers' Compensation fee schedules, and we'll also cover some updates payers need to know regarding the board's transition to the CMS 1500 form, followed by a few reminders about our payer compliance program. Finally, we will update you on the board's telehealth regulations and leave time at the end of the presentation for your questions. Let's start with our most timely update, and that's related to OnBoard limited release. As you are likely already aware, the board has been actively developing a new and improved business information system, OnBoard, to offer stakeholders, including payers, a much easier and more efficient way of interacting with the board. Since building a new integrated system from the ground up takes time, we started with some high priority processes that will benefit from moving online. Our very first release, OnBoard limited release, which is designed to move several key processes for healthcare providers and payers from paper to online, just launched the first of 3 phases yesterday. Phase 1 of OnBoard limited release, or OBLR, went live yesterday and is now being used for medication prior authorization requests, or PARs, which is replacing the current New York Workers' Compensation Drug Formulary prior authorization request process. As part of this implementation, medical marijuana will now be requested via a medication PAR, rather than the attending doctor's request for approval of variance in carrier's response, or Form MG2, which has been the process until now. In its first few hours, hundreds of medication PARs were already successfully flowing through the new system. The first phase includes a new online process for providers to submit a request for decision on unpaid medical bills, noting that the rest of the process remains the same. Just a brief reminder, in case you missed our communication yesterday afternoon, that eCase remains your go-to for the most up-to-date case information, including all PAR documents. All PARs, including new PARs created in OBLR and PARs that were processed and completed in the former drug formulary application, can be found within the case folder in eCase. You can search eCase using the claimant's case ID to see PARs related to the claimant, as well as the history of a particular PAR. Documents generated in OBLR are immediately placed in the claimant's case folder in eCase. Phase 2 will introduce durable medical equipment submissions to OnBoard on April 1st, 2022. Phase 3 will introduce the remaining PAR submissions for treatment and testing. Treatment and testing will include MTG confirmation, MTG special services, MTG variances, non-MTGs over $1,000, and non-MTGs under or equal to $1,000 on May 2nd, 2022. Since payers are one of the primary users of OnBoard limited release, it is critical that you understand the system, have registered for access, and designated the appropriate roles within your organization. We won't go into details here, but if you are not fully in the know or have not registered yet, the board has comprehensive information on OnBoard limited release, including a walkthrough of the registration process, video tutorials, recorded presentations, and a training on how the system, which we delivered just over a week ago, all available at wcb.ny.gov/onboard. Additionally, as mentioned, we will be hosting a special Q&A webinar for payers on March 16th, and you can find more details on that, including information to join, on the board's website. If you have questions, you can email onboard@wcb.ny.gov. Now let's go over some recent regulations that were adopted regarding the New York Workers' Compensation Drug Formulary. Legislation enacted in April 2017 required the board to establish a drug formulary under which all prescriptions must comply. The formulary includes a list of preferred medications that can be prescribed to injured workers without any prior approval. In conjunction with OnBoard limited release, all new as well as refill prescriptions must now comply. A renew or refill is a medication the patient has been currently taking or the same medication in a lower strength. Requests for non-formulary medications will need to go through the medical portal process. In November 2021, the board announced that payers would be required to provide prescribers with a list of their patients currently taking non-formulary medications on or before January 5th, 2022. Payers were also required to notify patients taking non-formulary medications of the medications and instructed to talk to their providers. As mentioned earlier, prior authorization requests for medical marijuana will no longer be submitted via the existing variance request process, but will instead be submitted with an OnBoard limited release as a medication PAR, although the criteria needed for approval will remain the same. More information about the formulary can be found on the board's website. Select Providers at the top of the homepage, scroll down to Resources, and select a drug formulary under the Treatment section. Another key area of focus for the board has been the New York Medical Treatment Guidelines, or MTGs. Medical treatment guidelines are evidence-based guidelines for the treatment of injuries that fundamentally change the delivery of healthcare to injured workers when they are implemented in 2010. On October 13, 2021, the following MTGs were posted for public comment: TBI for traumatic brain injuries, CRPS, complex regional pain syndrome, and occupational eye disorders. The public comment period has closed for these MTGs, and the comments are being reviewed and processed. The adoption of 3 new MTGs, along with the other new and updated MTGs, will coincide with the third phase launch of OnBoard limited release, which is currently slated for May 2nd. This will include some minor edits and clarifications to all 3 MTGs based on the public comments received, but no major changes. The following updated MTGs will become effective on May 2nd, 2022. Neck, shoulder, mid and low back, knee, and non-acute pain. Following new MTGs will become effective on May 2nd, 2022. Ankle and foot disorders, elbow injuries, hand, wrist, and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational or work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, traumatic brain injury, complex regional pain syndrome, and eye disorders. Board has online training available on the MTGs for both medical and non-medical professionals. Payers should complete the non-CME versions of each training. To access them, visit the board's website at wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, select the training link on the right side of the page. Now let's look at some updates regarding the New York State Workers' Compensation fee schedules. As you may be aware, one of the actions the board has taken to improve the workers' compensation system is to implement new fee schedules with higher reimbursement rates for all provider types, as well as additional increases for certain specialty provider groups. Information can be found on the board's website regarding the following fee schedules: inpatient and outpatient fee schedules, workers' compensation enhanced ambulatory patient group fee schedules, podiatry fee schedule, dental fee schedule, private psychiatric hospital fee schedule, durable medical equipment fee schedule, and fees paid for out-of-state care. Visit wcb.ny.gov and type fee schedules in the search bar at the top of the screen. Payers should be aware of the enhanced reimbursement benefits for providers established by the board in 2019. First is Ground Rule 17, Designated Provider Enhanced Reimbursement. In an effort to increase the number of board-authorized providers in the primary care medicine, which is family medicine, general practice, and internal medicine, specialties available to render care and treatment to injured workers, the board has established board-specific modifier 1D, which will provide a 20% reimbursement increase to providers with board-assigned rating codes and services. Under Ground Rule 18, Behavioral Health Provider Enhanced Reimbursement, the board has established board-specific modifier 1B, which will provide a 20% reimbursement increase to providers with board-assigned rating codes for designated services. Please note, if a designated provider has billed for services using the appropriate modifier and has not been paid appropriately, they may file an HP1, which, as we just shared, will now be submitted through OnBoard limited release. Now let's look at some reminders for payers regarding the board's transition to the CMS 1500 form. As of October 1st, 2021, payers must electronically accept the CMS 1500 form, which can be EDI or another agreed-upon format. Payers will electronically transmit the explanation of benefits, explanation of reviews to their XML submission partners upon adjudication of the associated electronic CMS 1500 form medical bills and acknowledge the medical bills within 7 business days. XML submission partners must be designated as of October 30th, 2021. Please note, the only basis for a payer to reject an electronic bill from the designated XML submission partner is if a mandatory field is incomplete or the payer does not provide coverage to the employer. A rejection of an electronic bill must be made within 7 business days of the bill's initial transmission date from the healthcare provider's XML submission partner. As of November 1st, 2021, payers are now required to identify all legal and valuation objections to payment of the medical bill and submit them at the same time on the same EOB/EOR. Payers will be required to make such objections within 45 calendar days of acknowledgement of receipt of the medical bill, whether on paper or digital. The payer must also continue to file such objections with the board using the current versions of the Notice of Treatment Issue Disputed Bill, Form C8.1B, and or the Notice to a Healthcare Provider and Injured Worker of a carrier's refusal to pay all or a portion of a medical bill due to a valuation objection, Form C8.4, along with a copy of the EOB/EOR to object to payment of a bill, also within 45 calendar days of acknowledgement of receipt of the medical bill, again, whether on paper or digital. Subject number 0461452, which can be found on the board's website, clarifies the payer requirements related to the initiative. Beginning July 1st, 2022, payers are required to use the new Form C8.1B and Form C8.4 with applicable CARCs to object to medical bills. Payers must also provide the EOBs electronically to healthcare providers identifying the same CARCs as specified on the Form C8.1B or Form C8.4. However, there will be a 45-day grace period for payers to accept the older versions of Form C8.1B and Form C8.4. Providers must submit the CMS 1500 form. Electronic submission through an XML submission partner is strongly encouraged, though it is not required. When mandatory submission of the CMS 1500 form begins, use of current medical billing reports, including the doctor's initial report, Form C4, and the doctor's progress report, Form C4.2, will be discontinued. If a provider submits Form C4.2 after July 1st, 2022, payers should not reject it. Instead, please file Form C8.1B and use the objection medical report for treatment was incomplete or not in prescribed format. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. It is important to note that while electronic submission of medical bills by providers through an XML submission partner is being strongly encouraged, it is not required. When providers submit CMS 1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the payer and the board. If a payer fails to accept electronic medical bills, penalties may be assessed by the board. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies provider submissions of the CMS 1500 form. The template includes the 3 mandatory elements to include with most narratives: the patient's work status, causal relationship of the injury to the patient's work activities, and temporary impairment percentage. These elements are important for you to note as payers. A medical narrative report may be found legally defective if these elements are missing. Please note the CMS 1500 initiative does not change anything related to a payer's assessment of causal relationship. It merely requires causal relationship to be reported prominently in the medical narrative. A PDF of the report can be found at wcb.ny.gov/CMS1500/requirements under the medical narrative requirements section. More information on the CMS 1500 initiative can be found on wcb.ny.gov/CMS1500, or you can email cms1500@wcb.ny.gov with questions. We would now like to provide a brief update on the board's payer compliance program. By way of background, the board established its payer compliance program in 2015 to help injured workers receive timely benefits and keep a level playing field among payers. Our initial focus was on timeliness of first benefit payments. In late 2020, we embarked on our second phase of the program, in which the board began monitoring the timeliness of the subsequent report of injury suspension filings, SROI-SX, which are required when indemnity payments made to the injured worker have been suspended. Pursuant to WCL Section 25(1)D, whenever, for any reason, compensation payments cease, the employer or its insurance carrier shall within 16 days thereafter send to the chair a notice on a form prescribed by the chair that such payment has been stopped, which notice shall contain the name of the injured employee or his or her principal dependent, the date of accident, the date to which the compensation has been paid, and the whole amount of compensation paid. The penalty for a late filing of a suspension under WCL Section 25(1)D is $300, which shall be payable to the injured worker. Pursuant to WCL Section 25(3)E, if the payer or employer fails to file a notice or report requested or required by the board, or otherwise required within the specified time period, or within 10 days if no time period is specified, a $50 penalty may be imposed, which is payable to the board. Filing shall be late if filed more than 16 days after benefits cease, unless benefits were being paid pursuant to WCL Section 21A at the time of the suspension. If benefits are being paid pursuant to WCL Section 21A at the time of the suspension would be late if not filed within 5 days. If the payer or employer fails to file a notice or report requested or required by the board, or otherwise required within the specified time period, or within 10 days if no time period is specified, the board may impose a $50 penalty. The board uses of the following dates to determine the timeliness of the suspension filing, whichever is latest. Benefit payment issue date, DN0192, benefit period through date, DN0089, or the suspension effective date, DN0193. Starting in 2021, the board began issuing penalties if carriers did not meet specified performance standards each quarter. The standards were gradually increased to where they stand today at 85% compliance. You can email monitoring@wcb.ny.gov with questions. Questions on the proper EDI filings, please email eclaims@wcb.ny.gov. You can also find more details by visiting the board's website at wcb.ny.gov, selecting Insurers on the homepage, and then selecting Monitoring and Compliance. Finally, we have a quick update on the board's telehealth policy, which is implemented on an emergency basis on March 16th, 2020, at the start of the COVID-19 pandemic. Emergency telehealth regulations have been in place since March 16th, 2020, to allow telemedicine in some circumstances for social distancing purposes due to COVID-19. The most recent telemedicine emergency adoption was filed on January 11th, 2022. A notice of emergency adoption was published in the January 26th, 2022 edition of the State Register and includes billable codes for telemedicine, which is important for payers to be aware of. Recognizing the widespread and successful use of telehealth in the workers' comp and healthcare more broadly, permanent telehealth regulations were proposed on July 14th, 2021. The notice of revised rulemaking was published last week in the March 2nd, 2022 edition of the State Register. Comments on the revised proposal will be accepted for 45 days after publication. As we continue to work on implementing improvements for payers, we're committed to increased communication with payers, such as this webinar and targeted emails. The board also has a special webpage for payers. Please visit the board's website at wcb.ny.gov and select the payers link at the top of the page. We will be expanding the content on this page by creating a What Payers Need to Know briefing page that highlights key activities, much like we've done today. We also continue regular engagement regarding OnBoard. As primary users of the new system, your input and engagement in the project is very important. We will continue to hold OnBoard related webinars and trainings because we want you to help champion the system as it rolls out. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you would like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. If you have payer-specific questions, you can call the helpline at 877-632-4996. You can also visit our website at wcb.ny.gov and select the Payers link at the top of the homepage. Thank you for attending this presentation on important updates for payers. We will now take the rest of your time to answer any questions you may have.